What if I told you there's a procedure quietly offered at the end of pregnancy, often framed as no big deal, sometimes pitched as a shortcut to labour, yet many parents walk away unsure if they ever truly consented to it. Now, in this demonstration, your cervix is just slightly open, so the orange is mimicking the cervix and the blue is showing us that amniotic sac or your waters that baby then sits inside. Today we're talking all about stretch and sweeps. You might have heard it called a membrane sweep. Maybe it was offered casually at a routine appointment, maybe you said yes, maybe you said no, or maybe you didn't even realise you had a choice. In the UK, sweeps are usually offered from around 39 weeks of pregnancy onwards and might be offered again if labour doesn't start. This conversation isn't about fear, it's about information, power and autonomy. What stretch and sweeps actually are, how they work, what the evidence says, and why so many birthing people have such strong feelings about them on both sides. Because when it comes to birth, knowledge isn't just helpful, it's transformative. So let's get into it. A stretch and sweep in pregnancy, sometimes called a membrane sweep. We're going to talk about what it really is, what the evidence says, and how to work out whether it's even the right option for you. Now, if you have been offered a stretch and sweep, or maybe you've heard other people talking about them, sometimes you'll hear people casually say things like, just get a sweep and it will start labour. And I want us to just slow that conversation right down, because for some women, a sweep does really seem to help things along. But for others, it will do absolutely nothing. And for some, it can just leave them feeling sore, confused, and maybe wondering why no one actually explained it properly to them. So today, I'm going to talk you through what a stretch and sweep actually is, what it's trying to do in your body, and what the evidence really says about how effective it is. And then how to decide whether it's something that you want rather than something that you could feel pressured into. Now, this is not telling you to say yes or to say no. It's about giving you enough understanding to feel steady in that decision, either way, whatever one you might make. So we're going to start at the beginning, because when people talk about a stretch and sweep, what they usually mean is a membrane sweep. Now, it's important for you to know that it's done as a vaginal examination where your clinician will place a finger slightly inside the cervix. So, for the purposes of this, we have our baby. Yours will be much prettier than mine, do not worry. And then we have our cervix. So your baby's head is usually pressed against the cervix like this. Now, in this demonstration, your cervix is just slightly open. So the orange is mimicking the cervix and the blue is showing us that amniotic sac or your waters that baby then sits inside. What your clinician will do through that vaginal examination is place a gloved finger, hopefully inside the cervix, and gently try and sweep to separate those two layers, so the cervix from the outside of the membranes around baby. Now, if your cervix is already slightly open, like this one, the sweep can be done more fully. Whereas if you imagine that cervix was really quite closed, it's really hard to be able to do that. And it might be more of a very gentle stretch, or even just kind of a massage, than a full stretch and sweep. Now, the reason it's called a stretch and sweep is because, yes, we're trying to sweep that cervix from the lining of the membranes. And then we're also, if we can get another finger in, or even just with the one, trying to gently stretch that cervix as well. Now, here is the really important thing to understand. A sweep doesn't switch labour on, and it doesn't force your body to go into labour. What it's trying to do is more of a nudge, nudging hormones that are hopefully already kind of getting ready. The goal is then to release prostaglandins. Now, encouraging these is helpful. These are chemicals involved in the softening of the cervix and helping your uterus or your womb to become more active, to encourage those contractions for labour. So by kind of irritating that cervix slightly through the stretch and sweep, Prostaglandins can be released really locally in that area that we really want them. And sometimes that's enough to kind of tip things over into labour starting. I said sometimes. And that's where I want to share one of the biggest misunderstandings when it comes to stretch and sweep. And that is, in complete honesty, a sweep will work best when your body is already close to labour. So if your cervix has already started to soften, shorten, or open slightly, a sweep is much more likely to have an effect. Whereas if your cervix is still very high, it's very firm, it's closed, a sweep is much less likely to do anything at all. So it's not about how badly do you want labour to start? It's more about, okay, what's my body already doing? In the UK, sweeps are usually offered from around 39 weeks of pregnancy onwards and might be offered again if labour doesn't start. And the idea is to try something kind of relatively low intervention before moving on to a formal induction. But we have to talk honestly about the effectiveness of stretch and sweeps, because this is the part that women really need clarity on. When we look at the research, including large reviews that pulled together lots of different studies, what we see is that membrane sweeping does increase the chance that labour will start on its own, but the effect is modest. Now, one of the clearest ways to understand this is something called the number needed to treat. And in simple terms, it basically means how many women need to have that stretch and sweep to prevent one formal induction of labour. Now, the evidence suggests that it's around 7 women would need to have a sweep for 1 woman to avoid an induction. Now, that's helpful, but it's not dramatic. And another way to look at this is that without sweeps, roughly 3 out of 10 women will go on to have an induction. With a sweep, that number drops to around 2 in 10. Now, I really like exploring statistics around labour and birth in different ways because they'll resonate or click with different people. So another frame we can use is that a sweep can reduce the chance of medical induction in 75% of first-time mums and 80% in subsequent pregnancies. And that 79% of women will labour within 7 days of a membrane sweep. It tends to decrease the length of pregnancy overall by 1 to 4 days. So yes, the stretch and sweep can make a difference, but it's not a guarantee. And it doesn't mean that labour will start immediately or smoothly. And this is a really important point that also often gets missed, because sweeps don't reliably change how labour unfolds once it has started. They don't guarantee a quicker labour, they don't guarantee fewer interventions or a particular type of birth. They're really focused on that starting of labour, not then controlling it. And I'm just curious here, if you have been offered a sweep, how do you feel about it? Do you feel relieved, unsure, pressurised, just desperate for pregnancy to be done? Let me know in the comments, because honestly, those feelings really matter. And there's often not a space to really unpick those and consider them. So this is our opportunity. Now let's talk about what it actually feels like and what's normal afterwards as well. Now, a sweep can be uncomfortable. Some women describe it as pressure. Others will describe it as cramping or a sharp stretching sensation. Some find it manageable, other women really don't. There's no right or wrong, and there's no kind of real normal here either. Afterwards, it's common to have period-type cramps, a little bit of bleeding or spotting, and sometimes some kind of irregular contractions that might start and stop. You might also notice some discharge or some mucus that comes away, and all of those things are in the range of normal responses after a stretch and sweep. What isn't normal is heavy bleeding, soaking through pads, severe pain that doesn't ease, noticing reduced or changed movements for your baby, or feeling generally unwell, if any of that happens, you should always contact your maternity team. One thing I want to be really clear about with stretch and sweeps is risk. For most women with uncomplicated pregnancies, sweeps are considered low risk. They don't appear to increase infection rates as long as your waters haven't already broken. And they have been used for years and years in maternity care. But that said, the term low risk doesn't mean that there are no downsides. They can be painful, they can cause bleeding, they can trigger days of kind of stop-start contractions that can be exhausting. And occasionally, a sweep can accidentally break the waters. So again, it's a nudge, but we have to remember that nudges aren't always completely gentle. There's also times where actually a stretch and sweep just isn't appropriate for you. So if you have a placenta previa, unexplained bleeding, your waters have already broken, a sweep usually isn't recommended. And if your care team has advised against vaginal examinations for any reason, that guidance, of course, always comes first. And that kind of brings me on to something that I care really deeply about, and that's consent. Because being offered a sweep or any intervention in pregnancy doesn't ever mean that you have to say yes. And saying yes should never mean that you don't then get to ask questions. So it is okay to ask, what is my cervix like right now? What are we hoping to achieve with this? What happens if I say no today? Can we revisit this later? A sweep is optional, and informed choice is just part of good care, standard care. It should always, always be taken into account. So if you do decide that you want to have a stretch and sweep, there are some ways to make it easier. Slow breathing is one of those, especially during the examination, thinking about breathing outwards. This can be really effective because it can help to reduce any tension in your pelvic floor, and that pelvic floor relaxing can make it easier for your examiner to do the stretch and sweep, therefore it's less uncomfy for you. I'll often tell women to wriggle their toes because that can again help to relax that pelvic floor and that pelvic area. Clear communication. So you might be someone that wants to know every step of the way what your examiner's feeling. You might be someone that wants none of that. So just communicating what you're most comfortable with. Changing position if needed. So sometimes I'll ask women to make a fist with their hands and to pop that in the small of their back to help bring their cervix slightly further forwards. And knowing that you can ask to stop. At any point, you are completely in control. You can ask to stop. And these little tweaks can make a really big difference. Then afterwards, plan to rest, take it a bit easy. Cramping can kick in. It's not a time to suddenly schedule a crazy busy day. And I want to touch briefly on the kind of wider question that often sits underneath stretch and sweep conversations. And that is around induction of labour, and particularly, what else can I do to avoid an induction of labour? Because there is a lot online about natural ways to start labour, and much of it, to be honest, is not strongly evidence-based. Some things are harmless, some are just ineffective, but some can be risky. Now, membrane sweeping is one of the few non-drug methods that does have evidence base behind it for reducing the likelihood of formal induction. But even then, it's about probability, not certainty. Supporting your body to feel rested, nourished, hydrated, and safe really matters. Not because it guarantees labour. You know, we think that labour starts when your baby releases a substance from their lungs that triggers your body to start that whole process of contractions. We cannot control when that happens. But what we can control is our readiness when that time starts. So let's just bring all this together. A stretch and sweep is a membrane sweep. It's aiming to release prostaglandins and encourage labour to start. It helps some women, it doesn't help others. It's most effective when the body is already close to labour and we're giving you a nudge. It's optional, it's never a promise, and the right decision is the one that feels informed and aligned for you. I hope that's been helpful, but before you go, I would also just love to know this. If you have been offered a sweep, what do you wish someone had explained more clearly? Or if you haven't, what's your biggest question about it? Pop it in the comments, and if you want, include how many weeks pregnant you are too. And if you want more calm, evidence-based pregnancy and birth education that helps you feel steadier rather than more overwhelmed, hit subscribe. You deserve information that supports your confidence, not your fear.